Welcome to the Southwest Vermont Chamber of Commerce Expert Power Hour. Sit back, relax, and learn from the expert. Welcome to the Southwest Vermont Chamber of Commerce Expert Power Hour. Welcome to the Southwest Vermont Chamber of Commerce Expert Power Hour. Sit back, relax, and learn from the experts.
Hey, well, welcome everybody to one of our power hours for the Chamber of Commerce, the Southwestern Vermont Chamber of Commerce. I'm Matt Harrington, the Executive Director.
And I am Erica Floriani, Membership Manager.
We love to go live with the help of Catamount Access Television from time to time, especially out to the greater community. When we have great relevant information, everybody's looking how to keep their employees, how to build a safe and credible workplace, and also the big one, which is all around what does healthcare look like next year. So we love to partner with the Richards Group every November. We were trying to tally up the years. I think it's been at least over 5, 6, 7, maybe, because we were doing it in some places before we went digital. But we love to work with Jesse Jacobs with the Richards Group to introduce through your chamber membership, for those that are members of the chamber, the VACE program, VACE, which offers everything from dental, vision, pet, and some other ones that Jesse's going to talk about at a group rate. Because you are members of this Chamber of Commerce, we can offer those at discounted group rates. And then obviously we want Jesse to talk about healthcare. Chambers cannot offer healthcare, group rate healthcare, due to the legislative law that was put in place some 6 years ago. So we would love to, but we can, and I don't think there's probably any glimpse in the future that we will be able to. But we do, where we can, we love to help our members group together. We're getting feedback here. And so with that, we have got some people in the audience here on our Zoom call, and then hopefully people out there in Facebook land and other areas that may have some questions. We'll try and monitor on our end. But without further ado, I do want to pass it over to Jesse Jacobs from the Richards Group. Jesse, maybe just give a little bit of a quick history of your career, what you do at the Richards Group, and then let's hop right into the program.
Sure. Well, thank you for having me. I'm Jesse Jacobs with the Richards Group. I have spent my entire career in healthcare. I worked at Blue Cross and Blue Shield for about 14 years, and then worked on the exchange implementation team while I was there. From there, headed over to Vermont Health Connect and did a few years there and learned a lot about kind of the state side of things and the Medicaid program as well, because it's all rolled in under one department at the Department of Vermont Health Access. And about 8 years ago, I landed back at the Richards Group. So on the other side of the table, working with employers, and this is kind of my happy place. So thank you all for having us. We are the consultants to the VACE insurance program. In addition, we are also employee benefits brokers that work directly one-on-one with employers. Today is a two-part kind of review of the VACE insurance benefits, the employee benefits package that you have access to as chamber members. We're just going to do a kind of a review of those benefits so that it's fresh in your mind, you know that these are available. And then we're going to pivot to kind of an update of what's happening at the federal and state level with small group health insurance, with individual insurance, with the subsidies and all of that goodness. So I am just going to share my screen. I didn't prepare anything for the VACE benefits. I thought it may be helpful to show more of like the website and how to navigate it. So we've tried to make this as self-service as possible. This is kind of the homepage, vaceinsurance.com, and it has kind of all the information that you would need to offer employee benefits. We allow sole proprietors all the way up to businesses of 100. When you get around 50 employees, it may make more sense to purchase these benefits directly from the insurance company or work with a broker to do that. The real intention of this program is to service the majority of the Vermont Chamber members, which are sole proprietors and small businesses. And so that's what these benefits offer, is special products that you cannot access by going directly to the insurance companies. So this is the homepage here. From here, Delta Dental is the most popular employee benefit that's offered through the VACE insurance program. They had a really good year experience-wise, claims experience-wise. So the rates are not changing for 2026. That's wonderful news. And even more great news is that coverage B, which is basic restorative services, things like, maybe I can pull up an example. The dental review right here. Oh, that's really small. Let's see if I can make it bigger. So coverage B is the basic restorative services. And there used to be a waiting period on here of 6 months, which meant if you were new to joining, you had to wait 6 months before Delta Dental would pay for their portion of basic restorative services. We have removed that, so anybody new to the plan does not have to observe that waiting period. They're immediately eligible for basic services. And anybody that's in a waiting period now will have that waived starting January 1st. For coverage C and D, major and restorative services and orthodontics, we reduced the waiting period from 12 months down to 6 months. So that gives, people access to these services much quicker than the 12-month waiting period. Same thing will happen with these two benefits. If they're in the waiting period, it'll go away starting January 1st, and anybody new to the plan will not have to observe the 12-month waiting period. They will have the 6-month waiting period. Another thing that's important to understand is that this plan is very rich in terms of the benefits that it offers. All dental plans are going to have a calendar year maximum, which is the most Delta Dental will pay towards your dental care in a year. And the calendar year max on this plan is $2,000 per person. That is the highest you can get through the VACE program and going direct to Delta Dental. So it's a very rich benefit. And the premiums for this benefit are actually a little bit less than what you can get by going direct. So by leveraging your chamber membership and enrolling in the VACE dental plan, you're not only getting a very rich benefit with good coverage, but you're getting it at a more affordable price than you can get out in the open market. Also, just a quick reminder, we had sent this out as part of the renewal, but these benefits are flexible. So you only need one person to enroll. You don't have to meet the minimum participation. So most dental insurance plans and vision, if you go direct to the insurance carrier, you have to have at least 2 people, or sometimes it's more, enrolling in order to sponsor that product. VACE doesn't have that requirement. So even right now, if you wanted to say, as an employer, we're going to put together a benefits package where we offer dental and vision, you can commit to that in a way, even if you don't have any employees electing those benefits at this time. And then when you do have the employees onboarding, expressing interest in these benefits, we can add them, quite easily. There's not a lot of requirements up front in order to be offering these benefits. So that was dental. The vision is the same as last year. So this is the most generous vision plan that Delta Vision offers. It has a $180 allowance every 12 months towards the cost of frames and lenses. And all the information is outlined here. The copays are $10 for exams, and the materials are all here. We still have the 2025 materials up there, so in case anybody wants to join for December, because you can join at any time. But the 2026 information is also here. No change to these premiums next year either. This particular plan is in a 4-year rate hold. And I think we're headed into year 3, maybe year 4, but we have had consistent premiums in this program for at least the last 2 years, maybe 3. So that is a great benefit. The out-of-network benefit is becoming more commonly utilized, and that is kind of part of a broader trend of, optometry offices not having the staff or not having the interest to work with insurance companies, and so they drop out of network. We're seeing it not only with the iMed network, but other vision networks. So I wouldn't say that it's specific to the iMed network, but there is an out-of-network benefit on this iMed exam, and that allowance can apply to that out-of-network benefit. So there still is some benefit to offering a vision plan, even if there aren't any in-network providers in the local area. So signing up for both dental and vision are quite easy. The employer fills out something called the joinder, which I think we have right here. It's combined for dental and vision. You can do either or. So if you want to just select vision, it's one form for all, and you would just fill out the parts applicable to vision. And then employees would fill out an enrollment form. And there are 2 enrollment forms, one for dental and one for vision. Once those paperwork pieces are completed, you can send them directly in by following the instructions outlined here. There's instructions right here on how to enroll, or you can submit through your broker. If you have an employee benefits consultant that you're already working with and you want them to manage that part of the process, we're happy to do so. They're happy to do so. Just send it in. And they will kind of be your contact for the dental benefits going forward. Once Delta Dental receives it, they will reach out to you via email and send you instructions for creating an account on the group admin portal. That is the Delta Dental portal preferred way for managing ads and terminations throughout the year. And they also have an e-billing portal where you can sign up to receive and pay your invoices monthly via their billing website. A couple of other benefits that we added last year, worksite benefits right here. So these are, they are not, well, they are voluntary benefits. So as the employer, you are sponsoring them, making them available. You can choose or not choose to contribute anything towards the cost of coverage, but they are employee elected benefits. And the employee can decide on how much coverage they want. For accident, this is a benefit that pays you a flat dollar amount, a flat sum, if you have a qualifying accident. And that cash is just intended to kind of reimburse you or to subsidize the cost of medical care that you had to seek as a result of the accident. It's not tied to insurance in any way. So, if your insurance paid in full for that, accident care, then great. They're still going to, this accident policy would still pay out a defined benefit amount in cash. It's not treated as income to kind of supplement any out-of-pocket costs you have. Critical illness is another one that people are interested in. This one pays a very large lump sum if you were to be diagnosed with any of the critical illnesses that qualify. There is a disability benefit. So if you're not in a position to sponsor a group paid or an employer paid short or long-term disability plan, you can give access to your employees to purchase their own. And so they can self-select their own waiting period before benefits begin, how much of their pay they want to be reimbursed, and they can play with those 2 numbers to kind of get to a premium that's affordable for them. And then there's whole life and term life insurance that is also being offered as part of this package. You are, again, making it available. The employees choose to elect it, and they are paying the premium. So as the employer, you're kind of agreeing to withhold the premium for the benefits that they've signed up for from their paycheck, pay the invoice in full, and then the policies are kind of owned by the employees. So if they left their organization or your organization and went and worked somewhere else, they can keep these policies in force by making arrangements with Colonial Life to pay the premiums directly to them. So these are great ways to provide access to benefits that your employees wouldn't have otherwise without a lot of investment on the employer's part. We have partnered with CS1, which is an enrollment firm, to help employers and their employees determine what their premiums are for these benefits. You really do need to sit down with somebody because you can buy various levels of coverage. Sometimes your age and demographics are a factor in calculating your premium, and it's just way too overwhelming for a broker or the employer to kind of sit with the employee and walk them through that process. So if you are interested in offering worksite benefits, the first step would be to reach out to CS1, and I'm happy to provide that contact information. I think we have it on here somewhere. Yes, we do. Tiffany Hyatt is our contact at CS1. You can just shoot her an email, let her know that you're interested in offering your employees worksite benefits. She will then kind of have a quick interview with you to determine what your goals are, which products you want to offer, and set up a time where employees can drop in maybe on a virtual meeting or schedule time with Tiffany so that she can walk them through each of the plans and help them determine what level of coverage they're interested in, or what they can afford. Then after she's met with everybody, she will put everything into a spreadsheet for you so that you can easily enter payroll deductions, and it's done. So we're trying to make this as simple as possible. Reach out if you have any other questions about how this benefit works. And then the final one we have is pet insurance. So PinPaws is the vendor that we prefer to work with. And that is mostly because their benefit is really flexible and it is 100% employee paid. So some of the older or original pet insurance products are network based, and a provider network never really kind of took off in the veterinary world. And so this product is a reimbursement type plan. So you can go and see any vet that you want, have the services, and then you submit a claim to PinPaws for reimbursement based on the product that you've purchased. There's different levels of coverage that you can buy to kind of meet your budget. Obviously, the younger pets are more affordable to insure than the older pets, but it doesn't have any of those pre-existing condition clauses or anything like that. You go out and you can tailor your coverage specifically to what you want. That offers kind of a reimbursement for wellness visits and vaccines. And also you can buy a plan that only covers kind of injuries and accidents. So this is kind of a great program where you can say you offer access as the employer to pet insurance. The employee gets the URL that's tied to your Chamber of Commerce, and they go out, and in that URL is the 15% discount already included in the premiums that are shown to the employee. And when the employee figures out what they want to purchase, they put in, their banking or credit card information, and it's a direct relationship with PinPaws that they wouldn't have otherwise if you hadn't offered it to them. So that's kind of the summary of the four main employee benefits that the VACE insurance program is sponsoring for next year. I am always available if you have any questions, if you're out here navigating the website and need a little bit of help. Feel free to reach out, but we tried to make it as self-service as possible too, if you're somebody that is can go it alone. Any questions about the VACE insurance plans, or how to enroll, or any of the changes for next year?
And people may just have to unmute themselves or write it in the chat. And we are also keeping an eye on the Facebook chat as well.
I do have a quick question about the pet insurance. People were wondering, do you have a list of what you can get reimbursed for and how much you get reimbursed for it? We only saw some of the things that were up there.
Yeah, let me see if I have anything in my files here. I do have, and did we put anything up here? No, that's probably what we could do to improve is put kind of some examples of the different levels of coverage you can get. I'm just gonna go in
Yeah,
here.
they're just kind of wondering how much they would reimburse for a wellness visit.
Yes.
That's it.
It doesn't go into the details here.
No, I couldn't find anything.
Yeah. So what I will do is see if I can request some materials from PinPaws to explain. Like if you're in the URL and you're messing around, you plug in the details about your pet, it'll tell you kind of how much or what the summary of what the benefit is for what did they call it? The routine care. So there's like routine care, which is the wellness checkup and the vaccines. And it'll tell you kind of what that looks like. So I will take that as an action item and see if we can get more materials posted on the website that get into those benefits better. Thank you for
Okay.
that. Okay. Any other questions about the VACE insurance benefits? Okay. Well, now we will move on to the heavier stuff. I don't know if Zoom has fixed this bug or not. Can you see my screens? The orange screen that says keeping up with the credit?
Yes. Yep.
Yeah.
We're good.
Okay, great. Before, I want to let you toggle back and forth, so I'm glad they fixed that. Okay. So this is a presentation that I was planning to present to you, and then turns out I was asked last minute to also present to another audience last week. So if this is your second time seeing it, congratulations. I'll probably be better at it the second time around. But this is kind of a summary of what's been going on at the federal level related to healthcare. There's a lot of confusion out there. There's a lot of references to subsidies going away. My goal is to kind of clear all of the confusion up for you in 20 minutes or less. So here we go. So I am, as I had mentioned in the beginning, kind of an ACA girl. I just happened to be working on it for most of my career. So the ACA was it's also known as Obamacare, and it was enacted back in 2010, and it was a multi-year process for expanding access to health insurance, making it more affordable, and improving the quality of care. So a lot of what the immediate market reforms included that were required by the ACA were already in effect in Vermont. And I think a lot of people don't understand that. And that's kind of my favorite thing to tell folks is that we were already allowing children to stay on their parents' plans up beyond kind of 18. We had already banned lifetime limits. Those haven't been a thing for at least 25 years. We had already covered 100% preventive care at 100%, and we've already prohibited insurers from denying coverage for pre-existing conditions. And that actually happened back in the 90s. So anytime I hear about somebody asking about pre-existing conditions, it makes me think if they're from another state, because they just haven't existed. They haven't been allowed. Our insurance companies haven't been able to deny anybody for pre-existing conditions for such a long time. So the other big lift of the ACA was to launch an exchange. And by 2014, states had to decide whether or not they were going to do their own exchange or they were going to go to healthcare.gov. Vermont obviously decided to launch its own exchange known as the Vermont Health Connect. And the exchange is just a place where individuals can access qualified health plans, also known as exchange plans. And these plans meet a certain set of criteria, and they cover all essential health benefits, which was also defined as part of the ACA. But there are 11 essential health benefits that have to be covered. They're considered minimum essential coverage, also known as exchange plans. So the Shumlin administration, which was kind of the administration in office when we had to put the exchanges in force, they kind of took it a step further in Vermont, and they prohibited any off-exchange market. So essentially what that means is all small employers and all individuals are kind of in one risk pool. They have one set of qualified health plans to choose from. They are all on exchange. There is no off-exchange option. So every exchange, whether it's federal or state facilitated, offers subsidies. And the subsidies are known as, or have been known as, advanced premium tax credits. I still refer to them as APTC or advanced premium tax credits, but a lot of people are referring to them as subsidies. And these subsidies are calculated using an individual's household size and their expected modified adjusted gross income for the current year. These two factors are included in an affordability calculation that uses the state's second lowest cost silver plan, and an affordability percentage that's set by the federal government is typically 8 or 9% each year. So all of those kind of factors are brought together, and it determines what subsidy a person may be eligible for. And when these exchanges took effect in 2014, those subsidies applied to anybody earning less than 400% of the federal poverty level. Now, if your income was 138 or lower of the federal poverty level, then you qualified for Medicaid, and that's state funded. It's not really insurance, state funded program, health access program. But if you fell between 139 and 400%, you would get a subsidy towards the cost of a plan on the exchange that would lower, it would be subtracted from the, the market price of that plan. So all of this is kind of captured in one application. When you go to Vermont Health Connect and you fill out an application, it's screening you for Medicaid, it's screening you for subsidies, it's determining whether or not you're eligible. If you're not eligible for subsidies, it'll show you kind of the full cost options. And the downside to this program is that there is this cliff right here. If you make $1 more than what is considered 400% of the federal poverty level, you don't get anything in the form of a subsidy. You're paying full price for the cost of care. So ARPA, which came out in 2021 or was implemented in 2021, enhanced the existing subsidies. So what it did is it gave more money, more subsidies to the folks in this bucket right here, 139% to 400% of the federal poverty level, gave them more of a subsidy. And it also gave subsidies to people that were earning more than 400% of the federal poverty level. So it kind of eliminated this cliff. We call this line right here the cliff. You make $1 over, you don't qualify. So then, let's see. I just lost my place on my notes here. So this is, next slide. Hold on, my slides are not cooperating. Here we go. So this is a really busy table, but this is the Vermont Health Connect's 2025 income limit table. And so all here in white, you'll see there are different kind of segments of 400% of the federal poverty level and below, depending on where your income falls and how many are in your household size. That is kind of the high end of that category, and you would be entitled to a cost share reduction plan or maybe just a subsidy. A cost share reduction plan is a plan where you get subsidy amount to cover a big portion of your premium, but the cost share on the plan that they offer you is also lower. So they've reduced the deductible, they've reduced the out-of-pocket maximum, they've reduced or eliminated any copays. And so it kind of feels like a richer plan. And so if your income fell within any of these categories here, you would get what they call the cost share reduction plan. But if you're above that income limit here, you would still qualify for subsidy on a regular plan that's in the marketplace. But what is kind of key about what's been happening the last 5 years, is that the subsidies have been enhanced. So as an individual, you can earn up to $180,000 and still qualify for some kind of subsidy towards the cost of your plan. Couples can earn up to $360,000, and families of any size can earn up to $347,000 with and still be eligible for subsidies towards the cost of a plan. So essentially, I would say probably 95, maybe more % of the individuals enrolled on the exchange are getting something towards the cost of their plan, and many of them are getting greater subsidies than they would have otherwise. So this slide is the 2026 limits. So now that the subsidies are sunset, the enhanced subsidies are sunsetting, the cliff is back, essentially. If there is no enhanced subsidies to offer, if you still fall within 400% of the federal poverty level, you're getting less of a subsidy. And if you earn anything more, you get nothing again. So that's kind of what's happening next year, unless Congress decides at the last minute to make changes to this. But for me, I think the most likely scenario is that the subsidies will sunset as planned, and the affordability is going to be a big issue for everyone, not in just Vermont. Oh, and the cliff is back. I forgot about my little animation. Here's the cliff, the dreaded cliff that we all are talking about. So let's look at what this means for a plan and the subsidy amount. So here is an example. We're going to look at actually 3 examples and compare the subsidies that they would qualify for in 2025 versus 2026. So the first example, I'm a household size of 1. And when we're talking about household size, we mean tax filer household. So I'm single, I file single, I'm a household size of 1. If I have an annual income of $63,000, this year I've received $830 in subsidies towards the cost of my plan. And the monthly premium for a gold plan is $1,200. So I'm paying around $389 a month for a gold plan. Next year, though, I won't be getting any subsidies because I am over 400% of the federal poverty level by $400. So I get nothing. The monthly premium is jumping to $1,300, and that's 3.5 times what I'm paying right now. I should note that I'm using all Blue Cross premiums. They are higher than MVP. And I just figured we would go with Blue Cross because that seems to be what everybody uses as the baseline and our hometown teams. So these are Blue Cross numbers. MVP is a little bit less expensive, but still astronomically expensive if you're not getting a subsidy. So the second scenario we have here is a couple earning $85,000 a year. This year we would have qualified for $1,951, making our premiums about $487. Next year, we don't qualify for anything. Again, we are just $400 over the federal poverty limit of 400%. And the premiums next year are going up to $2,690, making our price 5.5 times more than what we were paying in 2025. And then the last scenario we have here is a family of 4 earning $95,000 a year. Our children will qualify for Dr. D, which is great. That is a wonderful program. And for now, Medicaid is not affected. There are some Medicaid changes coming for 2027, but for now, they haven't messed with it. So that's good. The children will, continue to be Dr. Dinosaur eligible. But if we plug in their income in the calculator, we'll see that they're only eligible for $340, the 2 adults in the plan. The kids will still be on Dr. Dinosaur, which is great. But because we are so close to that 400% of the federal poverty limit, our premiums are going to be 7 times more expensive than when we paid the previous year.
Jesse, one question in the comment box. Any guidance on difference between MVP and Blue Cross Blue Shield in care for employees in our region?
Yeah, so, what I think a common misconception is that there are a lot of differences between the carriers. And one of the, the myths that we try to dispel is that the essential health benefits package has been defined by the Affordable Care Act. So what's covered versus excluded with Blue Cross versus MVP is exactly the same. The things that are different between Blue Cross and MVP are things like their prescription drug formulary. Those may have some some differences between one or the other and where they fall in terms of cost share. The customer service is obviously different. MVP does have 2 businesses on 2 state exchanges because they are a New York health plan. So they've got New York exchange business and they've got Vermont. And so it may take you a little bit longer when you call customer service to reach a live agent, whereas Vermont has, customer service reps working out of their home office in Berlin. But beside that, like they both have national network access. And Blue Cross has historically kind of been stuck with the bad risk. And there's been lots of discussions about why this is. And I think a lot of it has to do with just people who are sicker and using more healthcare tend to stay where they are. And they were with Blue Cross to begin with, or they prefer Blue Cross because there's this, brand strength tied to them. MVP is also still trying to shake off their HMO reputation. So way back in the day, they were a strict HMO that required you to get referrals to see specialists. And there was a lot of paperwork involved. And we still work with employers that have that perception, even though we are a long ways away from those old days of MVP. So, when we're talking to individuals, I'm sorry for anybody that's out there because I have lots of friends at Blue Cross, but when it comes down to the price points, MVP is more affordable and, in my opinion, worth the additional effort in customer service if you ever needed to call them. I think they're just as quality of a plan. They are a nonprofit as well. But they are less expensive. And when we're looking at premiums this high for couples, then, that may make the difference of being able to afford coverage or not.
Great. Two more questions here. One is, can a married employee's spouse qualify or Medicaid or subsidy if the spouse doesn't work? We offer partial coverage for spouses, but that amount would be too much for the employee to pay.
Yes. So there was something called the family glitch on the Vermont Health Connect. It actually was on every exchange. So as long as if the employer was offering affordable coverage to the employee, then nobody in the family would be eligible for subsidies if they went to the exchange. And that was fixed, I think it was 3 years ago, maybe 4. And so what that did when the glitch was fixed was that, great, the employee has affordable coverage, they're all set. But the household members, whether it's the spouse and the children, they are still kind of entitled to whatever subsidy they would otherwise be entitled to based on their income, if they went out and applied to get their own individual plan on the exchange. And so if you have a situation where the employer is only contributing to the cost of coverage for the employee and it's deemed affordable, everybody else in that household can go to Vermont Health Connect, do an application as if the employee, kind of carving out their employee that has access, and they would be able to get subsidies on the exchange. Medicaid is purely income driven. So if somebody is below that threshold, they're automatically approved for Medicaid. So my recommendation would be, as an employer, to tell your employees if they are worried about affording family coverage through you as the employer, to have the spouse fill out an application with Vermont Health Connect, go through that screening process. It will ask questions about, does anybody else have access to insurance? And they say yes, and you answer that, and then it'll ask if it's affordable, and it'll ask, how much the employee has to pay towards the cost of coverage to do a quick affordability check. Because if the employee's portion is not affordable for employee only coverage, then everybody gets a subsidy on the exchange, and the employer could get penalized.
Okay. Last one that we have here for now is, how is gross income calculated for Vermont Health Connect? Employment income only or other income as well?
So it is your modified adjusted gross income. So the tricky part about putting in your income is you are putting in your expected or your anticipated income for 2026. So when you go to the plan comparison tool on Vermont Health Connect's website, you want to put what you expect to make, and you want to be kind of conservative in that. You don't want to overestimate your income or underestimate it too much, because it's going to just calculate willy-nilly a subsidy that you're entitled for. But then when you go to file your taxes, your 2026 income taxes in the first quarter of 2027, your actual modified adjusted gross income and the subsidies that you already took for 2026 are going to be reconciled. And so they'll run that calculation again. If you received more subsidies than you were entitled to based on your actual income, then they will collect that back. If you kind of overestimated your income and you ended up earning less and you had less subsidies, then they will credit you, or you would be entitled to a refund if you had enough remaining. So that is kind of the tricky part, especially if you're self-employed, because your income can fluctuate a lot from year to year. And so what we tell folks is go by your best guess, maybe use last year's modified adjusted gross income. There is a specific line on your tax return that has that number. And then you can update this at any point with Vermont Health Connect throughout the year. So if you see that your income is changing significantly in either direction, you can go out and make adjustments to your income, which would then carry through to your subsidies so that you don't have to make a big reconciliation when you file your taxes. Okay, so this is what the gold plan looks like. So we were talking about the gold plan before. What's interesting is that the gold plan is exactly the same for individuals and small businesses. And the markets were separated. So back in when we first launched the exchange, individuals and small businesses all paid the same premium costs for any given plan. They were identical. The markets were separated a few years back, and it has been made permanent. And so the difference between premiums on the small group market and the individual market are about 12%. Some of the plans are like 13%, but on average, it's 12% less expensive to sponsor a group health plan and pay the premiums that small businesses have access to. And so just by sponsoring, if you're worried about your employees not being able to afford their coverage because maybe you decided to drop it and send your employees to the exchange because the subsidies were so great the last 5 years, if that's not the case going forward, maybe it's time to reevaluate and consider sponsoring a small group plan again, because right off the bat, everybody saves 12%. That's not even including a contribution to premium. And there are other advantages for both the employer and the employee, because the employer gets tax deductions for their contribution to the towards the cost of premium. Employees get to pay for their healthcare with pre-tax earnings versus post-tax earnings on the individual exchange. There is a potential for small groups tax credits. It's a very narrow and difficult criteria to meet, but I'm happy to chat with anybody or send them a flyer on what that looks like. And I think that going forward, because we live in a system where, access to insurance is tied to employment, that this is going to become an even more valued benefit for employers and give folks a competitive advantage over small businesses that don't offer access to any kind of health coverage. And utilizing the support of a benefit consultant can help make things, go smoothly. We have connections with the carriers. We know exactly what needs to be done, the timeline. We can do employee education sessions and make sure that you as the employer are in compliance. So just something to consider if you feel like a lot of your employees are going to be impacted by this. And then this is my favorite slide, which is the menu of meh. Everybody kind of wants to know, well, what else is out there? What are my alternatives? And the more that I talk about these first two, the more that I realize that, the government was kind of throwing us a bone here. They're like, all right, we'll give you some exceptions, but we really want you to sponsor a plan. But if that's not in the cards for you, here are a couple of alternatives. So the first one is an individual coverage health reimbursement, or we call it ICHRA for short. And they work great in some markets, like next door in New Hampshire, where they have the lowest average premiums on the individual exchange. Unfortunately, we are in Vermont and we have the highest out of the country of the individual exchange premiums. So the reason that they don't work too well is that when you receive ICHRA money from your employer, you are automatically disqualified from any subsidies. So that means you're paying full price for the cost of an exchange plan, because the government sees the ICHRA funds that the employer is giving you as the subsidy. And so it kind of doesn't really make sense, because the individual premiums are about 12% more expensive than the small group premiums. And at that point, why not just sponsor a group plan and take the funds you were going to put in an ICHRA and apply it to a small group plan? So we're not having don't see a lot of traction with the ICHRAs in Vermont. QSARAs may be a suitable option. We have a lot of interest in those this year. they're only available to employers with 50 or fewer employees, and they can only be offered in lieu of sponsoring a group health plan. So you can't sponsor a group health plan for some and then offer a QSERA for others. It's all or nothing. But what ICHRAs do is it's tax-free money to reimburse employees for qualified medical expenses, which is, typically anything associated with their insurance, like copays, deductible, co-insurance, prescription drugs. You can also open it up to dental and vision expenses if you wanted to. And it also can reimburse employees for premiums on the exchange or Medicare, or I believe those are the only two. So Medicare or on or off the exchange, although off exchange is not an option where we live. So it can give employees a benefit kind of towards their health care without sponsoring a group health plan. You do need a vendor to administer them. We are not that vendor. We do partner with several vendors who administer them, but because you're giving tax-free money away, you really need plan documents, you need substantiation of claims, you need somebody making sure that you're in compliance with all the rules and regulations of that. And so there is usually an admin fee or a setup fee to get the plan up and going, and then there are ongoing per employee per month fees to having a QSERA in place. The off-exchange alternatives, we don't really have that many, and that is partly because of the way we implemented the ACA. There are level funded products out there that are becoming more popular because the premiums are calculated based on the specific risk of the employer itself, kind of in a vacuum, and not the community as a whole. And so if you have typically, a younger workforce, this may be a good alternative product. The downside is that it's not, a silver bullet for anybody by any means. We kind of refer to them as unicorns. If we quote out a level funded product for any of our clients and we get a competitive rate, that means that the premiums they've calculated are lower than what they would are lower than similar plans on the exchange. And in that case, yeah, it works great. It essentially means that you might be overpaying for the exchange plans because your employees aren't utilizing enough healthcare to kind of justify the premiums. So it's more of a, it's a great alternative, and it works beautifully when it works, but it is quite rare to find a competitive rate because you need that specific risk profile that's very competitive, and not everybody has access to that. The other thing is that claims experience when you have, a group of 5 is very volatile, and it only would take one bad claim to kick you out of this product, and you'd have to go back to the exchange. And then all of a sudden, your employees have been paying kind of affordable premiums for a long time. Then they stop and would have to jump back to the exchange and take that huge premium increase for the next year. And another thing we hear of a lot is PEOs. These are usually a payroll vendor that are kind of upselling their services to offer you a way to simplify benefits administration, and they would throw in maybe a benefit administration platform where employees can go and do onboarding and do their open enrollment through. And then they would say, we'll send all the data to the carriers for you. You don't have to do any forms. And we'll also give you access to this large group health plan. So typically large groups have more competitive rates because they have more people to spread the risk across. But our experience from clients we've heard from is that it is, the health insurance plan is from somewhere far out of state, and there is kind of no service after the sale. There isn't any employee education on the benefits. Maybe the network isn't as great as they initially promised. And so they're kind of left in this product that's very hard to untangle from, and we don't see it as kind of a viable option or alternative.
Jesse, a couple questions that are coming up. Maybe a slide or two ago, Southern Vermont Art Center asked, can you tell us how those benefits apply to nonprofit organizations of tax savings? So I don't know what that was in relation to. SVAC, if you want to add in.
Probably on this one, employer tax deductions.
Yeah, that one said, so yes. So how does, can you tell us how benefit apply to nonprofit orgs?
So the way that they would apply to small businesses. I think it's kind of heavier on the employee paying the pre-tax savings. A strategy we see lots of small nonprofits employ is giving stipends or bonuses or enhancing their salaries in order to kind of make up for the fact that you're not sponsoring a group health plan. And in doing so, you're artificially inflating this employee's income. So they are paying, instead of getting a tax-free benefit from their employer, they're paying more Medicare and FICA to go out and buy an individual plan on the exchange. And so the kind of the rules around taxation are driving small businesses and nonprofits alike to the incentives in sponsoring a group plan because of all of the tax benefits that are associated with that. So it will cost you eventually in the long run, even if you don't see the immediate pre-tax deductions for the employer contribution to premium.
Okay. Then we have is a QSE HRA different than an HSA?
That is not an HSA. An HSA is a totally different vehicle. So a QSERA is employer funded and it's use it or lose it. So if they don't have the qualified medical expenses, they can't access those funds. An HSA is an account that the employee owns and the employee and the employer can contribute to it as long as the employee is also enrolled in an HSA compatible health plan. So you cannot enjoy the tax-free benefits of a health savings account by funding it unless you are also enrolled in a compatible plan.
Okay, those are our questions.
Okay, great. So just this last page is kind of some resources for folks. The plan comparison tool is live at the Vermont Health Connect's website right now. This is just a calculator of the subsidies that people would be entitled to. So if you or you're worried for any of your employees, want to go out, plug in the data that you know about them just to see, kind of a quick test to see how much they qualify for or if they qualify for any subsidies. The 2026 subsidies and premiums are loaded. And so that gives you kind of an early sense of who of your workforce may be impacted. The KFF website is a great website that we're all following these days. It has a lot of information in an easy to read format. They are accurate, they're up to date. They're also following Medicaid if that's of interest to you. At least it's not this year, but next year there are huge, huge changes coming to Medicaid that we will be following to make sure that our clients are aware of. And then I've linked our 2026 summary of small group exchange plans and premiums in case you're interested. They're, both Blue Cross and MVP, they put them out on their own format. We've kind of combined both of those formats into our own format that we prefer because it's easier to read from our perspective. So that's out there. If you're curious about what are the price differences between the individual plans and the small group plans, you can go out there and see that information. And then just a quick little plug, it is unfortunate that we do have to charge our clients for managing their exchange plans. All brokers do now. It was part of the way Vermont implemented the ACA. And so, my advice, my self-serving advice is yes, I would work with an employee benefits broker to help get the plan up and running. We would, they'll help you understand all the plans that are available. They can make sure that you're in compliance because once you start offering group health benefits, you are subject to a whole set of new rules and regulations that you have to follow. They can kind of help you share what other employers are doing to give you some creative ideas of how you might set up your contribution to premium. And then the employee education piece is huge. Both, insurance companies allow you to offer all of the plans. And that's what we like our clients to do because then we can come in and help the employees understand what the differences are between the plans and they get to pick the plan that best suits their individual needs. And it takes the pressure off you as the employer from picking one or two plans to suit everybody. And so that is kind of my 2 cents there. This is my contact information at the Richards Group on our client portal. Reach out to us anytime if you have questions. We not only do the VACE insurance program, but we do an exchange business, but we also do, any other employee benefits as well. And happy to chat with anybody about their next steps.
Great. Any final questions for Jessie? And I know Jessie will make herself available after the fact. So if you have anything, but I think we've answered a lot of them. That was pretty dynamic. There are a lot of good questions there. Jessie, we want to thank you and thank the Richards Group always for providing this great information. We know it's timely. Jackie, we'll send out an email with slides and Jessie's email to all the participants on the Zoom call today. Before we go, one last program that we do. It's our annual holiday mixer. Maybe you want a cocktail and some food after seeing that presentation, and we're happy to provide that for you. So we're up at the Barrows House on Tuesday, December 9th at 5:30. So we're very happy to be up in the Northshire to celebrate the holidays with everybody. We so appreciate everybody hopping on today. And again, we'll get you information from Jessie as soon as we can get it out there. All right. And thank you to Cat TV, as always, for broadcasting us and organizing this platform. Thank you, everybody. Have a good rest of the week.
Take care.
Welcome to the Southwest Vermont Chamber of Commerce Expert Power Hour. Sit back, relax, and learn from the experts.